Can we help you do well? Innovative pilot to enhance quality of primary health care in Andhra Pradesh. While Andhra Pradesh, a southern Indian state, is one of the fastest growing economies, many health indicators continue to highlight undernutrition, infant mortality, maternal mortality, and prevalence of HIV, particularly among the socially and economically marginalized communities. To address these problems, the government of Andhra Pradesh is implementing an ambitious Andhra Pradesh Health Sector Reforms Program, APHSRP, with monetary support from Department for International Development, DFID, United Kingdom, and technical support from FHI, International Health Systems Program, Harvard School of Public Health, and Administrative Staff College of India. The main focus of APHSRP is to strengthen access to primary health care through a comprehensive approach of reorganizing service delivery structures and complemented by a human resource policy and key performance indicators. One such initiative is the Varndell Pilot, a demonstration project in 10 primary health centers focused on improving the quality of primary health services ranked by a report card, peer learning approach, and community participation. The interventions within this project involved developing facility-level report cards on key performance indicators pertaining to PHC's performance and also providing a platform for sharing the findings as well as problem solving. This report card also incorporates a structured community feedback. The parallel efforts included developing newer models of community participation, that is, working along with women's self-help groups to provide feedback on performance and also to facilitate demand generation. These SHG groups are known for their commitment and effectiveness in Andhra Pradesh. The term performance management reflects basic management mechanism that involves incentives to influence human behavior. Operating without performance management is like playing football without goals or passing through school without grades. It shows how much one is learning in comparison to one's peers. A team comprising of experts from FHI, the Harvard School of Public Health, and the Foundation for Research in Health Systems designed the model and initiated the interventions in 10 primary health centers, PHCs, located in Varndell district. The main objective was to test the concepts and practices based on the experiences of other countries and other states in India. It was expected that the PHC services would vastly improve through proper monitoring, community participation, using tools like report cards, stakeholder assessments, and feedback to providers from the community. The 5 key concepts that drew this pilot were quality enhancement (QE), performance management, peer learning, community monitoring, and performance recognition. Quality enhancement is a continuous process to improve service delivery. It uses Plan, Do, Study, Act (PDSA) concept underlying the Total Quality Management (TQM) approach. As such, key performance indicators were identified, followed by action for improvement and implementation. Once this was done, it was time to observe improvement in services provided at the PHCs. Lacunae, if any, were rectified by undergoing a repeat improved service delivery process. Performance management involves developing a mechanism that incorporates performance feedback. As a result, report cards were prepared to give PHC managers feedback about their performance, areas where they did well and scope for improvement. The report card was based on key performance indicators. It was collated from existing MIS and external evaluation data. The data for the stakeholder component was collected by the pilot team both at the beginning and at the end of the pilot. Peer learning involved a process wherein PHC medical officers were provided a platform to discuss their performance among peers from other PHCs. This interaction enabled them to do creative problem solving of the issues they faced that hampered their performance. Community monitoring is a mechanism for capturing community feedback on services provided and for suggestions on ways to improve the service delivery. This was also an attempt to involve the community in PHC service delivery. The data collected from each PHC was used extensively to assess PHC performance. This helped in identifying gaps, maximize the learning points, and assess the measures that failed. The solutions were developed in consultation with the high achievers. The pilot resulted in demonstrable improvements in the areas of information management and transmission between the PHCs and districts and lab functioning. The PHCs identified diagnostics as one of the weak links, addressed lack of technicians by sharing workforce across PHCs, developed MIS for laboratory performance and set standards for lab functioning. In response to feedback received from clients, a few MOs improved information sharing with their clients, while others maintained user-friendly environment like chairs in outpatient area. The MOs introduced service delivery initiatives, increased outreach activities in marginalized areas, and organized special screening camps for identified diseases. The main learning from this project are: sustaining performance management systems is the key to setting up performance management mechanisms. This program empowered the medical officers to take corrective actions and gave them real control over PHC management. It also encouraged communities to demand quality services. Community members need to be trained and educated about the roles and functions of PHCs. Communities also need time to build trust in the delivery of public health services. Also, the community needs to be aware of their participatory role in strengthening primary health care. Despite challenges, the Varndell Pilot has exhibited remarkable gains in a short period of time. However, this has to be linked to the HR systems of performance management. Among the medical officers, there is an overwhelming enthusiasm and support for this work. They themselves see the initial gains stemming from improved documentation and reporting, and peer learning and consultations. The next step is to integrate community consultations in order to enhance the quality of service at the primary healthcare level. Other performance management schemes were implemented in Andhra Pradesh previously, but abandoned due to high operational costs, especially when external assistance was withdrawn. The success of this pilot was received well by the government, and there is a strong commitment to scale it up in the entire district and then across the state.